Welcome to Exam Sale. In this video we will walk through the syllabus for the Test Prep United States Medical Licensing Examination and explain what to study and how the exam is weighted. The USMLE covers 14 domains with specific weights and scenario-based assessment. General principles is 14%, behavioral health and nervous system special senses 11%, immune system 8%, musculoskeletal skin and subcutaneous tissue 8%, reproductive system 8%, cardiovascular 7%, respiratory 7%, gastrointestinal 7%, endocrine 7%, blood and lympho-reticular system 6%, renal and urinary system 5%, multi-system processes and disorders 5%, biostatistics epidemiology and population health 4%, and social sciences 3%. General principles carries 14% and is rated hard with an estimated 112 hours of study. The assessment is scenario-based. This domain focuses on foundational scientific concepts including biochemistry, genetics, and microbiology that underpin medical practice. Expect to master gene expression, protein structure and degradation, enzyme kinetics, PCR and blotting techniques, fuel metabolism and central metabolic pathways, plus cell structure, cell cycle regulation, signal transduction, human genetics, embryology and developmental defects. Behavioral health and nervous system and special senses is 11%, hard, and requires about 88 hours of study with scenario-based questions. It covers the structure, function, and pathology of the central and peripheral nervous systems as well as behavioral health disorders. Study gross brain and spinal anatomy, motor and sensory pathways, cranial nerves, vascular supply, neurodegeneration and demyelination, neuropharmacology, and core psychopathology including mood, anxiety, psychotic and substance use disorders with associated psychopharmacology. Immune system is weighted at 8%, medium difficulty, with about 64 hours of estimated learning and scenario-based assessment. This domain teaches host defense mechanisms, innate and adaptive immunity, antibody structure and genetics, MHC and antigen presentation, cytokines and inflammatory mediators, and hypersensitivity reactions. You will also cover autoimmunity, primary and secondary immunodeficiencies, transplant immunology and rejection, immunotherapy, and labs for immune disorders. Musculoskeletal skin and subcutaneous tissue is 8%, medium difficulty, and estimates 64 hours of study with scenario-based testing. It focuses on conditions affecting bones, joints, muscles, skin and subcutaneous tissues and their clinical management. Learn limb and pelvic anatomy, bone physiology and remodeling, joint disorders like osteoarthritis and rheumatoid arthritis, muscle physiology and the neuromuscular junction, as well as skin histology, infectious and inflammatory dermatosis, neoplasms and pharmacological treatments. Reproductive system is 8%, hard, and recommends about 64 hours of study with scenario-based questions. The domain covers male and female reproductive physiology, pregnancy, and related pathologies for both sexes. Key topics include the menstrual cycle and hormonal regulation, ovarian and uterine pathology, breast disease, contraception and STIs, plus pregnancy physiology, complications like preeclampsia and ectopic pregnancy, placental pathology, male reproductive anatomy, prostate and testicular disease, and infertility. Cardiovascular system is 7%, hard, and needs roughly 56 hours of study with scenario-based assessment. You will study physiology and pathology of the heart and blood vessels including the cardiac cycle, pressure-volume relationships, hemodynamics, and regulation of blood pressure and heart rate. Pathology topics include ischemic heart disease, myocardial infarction, heart failure, valvular disease, congenital defects, cardiomyopathies, and relevant pharmacology such as antihypertensives and antiarrhythmics. Respiratory system is 7%, medium difficulty, with an estimated 56 hours of study and scenario-based questions. This domain covers pulmonary mechanics, gas exchange, and common lung diseases including ventilation perfusion matching, gas transport, lung volumes, acid-base balance, and control of breathing. Also focus on obstructive and restrictive lung diseases, pulmonary infections like pneumonia and tuberculosis, pulmonary embolism, neoplasms, and respiratory pharmacology. Gastrointestinal system is 7%, medium difficulty, and suggests about 56 hours of study with scenario-based assessment. It emphasizes digestion, absorption, liver and biliary function, and disorders of the alimentary tract and hepatobiliary system. Study GI motility and neural control, secretory functions, nutrient digestion and absorption, liver function and bile metabolism, exocrine pancreas, nutritional deficiencies, plus disorders such as esophageal and gastric disease, IBD, liver cirrhosis, biliary disease, pancreatitis and GI neoplasms. Endocrine system is 7%, hard, with around 56 hours of study and scenario-based testing. The focus is hormonal regulation and metabolic disorders involving the endocrine glands and hormone action mechanisms. Learn the hypothalamic pituitary axis, thyroid and adrenal synthesis and regulation, calcium and phosphate metabolism, insulin and glucose homeostasis, plus endocrine disorders like diabetes, thyroid disease, Cushing and Addison, pituitary adenomas, parathyroid disease and pharmacologic management. Blood and lymphoreticular system is 6%, medium difficulty, and estimates 48 hours of study with scenario-based questions. This domain covers hematopoiesis, coagulation, platelet function, and lymphoreticular malignancies. Expect to master erythropoiesis, the coagulation cascade and fibrinolysis, transfusion medicine, anemias of all types, bleeding and hypercoagulable disorders, leukemias, lymphomas, multiple myeloma, and myeloproliferative syndromes. Renal and urinary system is 5%, hard, and recommends about 40 hours of study with scenario-based assessment. It focuses on kidney function, fluid and electrolyte balance and urinary tract disorders. Key areas include glomerular filtration and nephron transport, acid-base and electrolyte homeostasis, the renin-angiotensin-aldosterone system and diuretics, glomerulonephritis, acute and chronic kidney injury, tubulointerstitial disease, UTIs, renal cancers, and congenital anomalies. Multi-system processes and disorders is 5%, hard, with about 40 hours of study and scenario-based questions. This integrative domain covers systemic inflammatory and infectious processes and organ dysfunction across systems. Topics include systemic inflammatory response syndrome, shock in its various forms, multi-system organ dysfunction syndrome, environmental medicine and poisoning, temperature regulation, and metabolic responses to injury. Biostatistics, epidemiology and population health is 4%, medium difficulty, and estimates 32 hours of preparation with scenario-based assessment. The domain teaches principles of evidence-based medicine, study design and basic statistical inference needed to interpret research and clinical data. Learn study types and trial design, measures of central tendency and variability, hypothesis testing and p-values, bias and confounding, diagnostic test characteristics and risk measures such as relative risk and odds ratio. Social sciences is 3%, easy, and suggests about 24 hours of study with scenario-based testing. This domain focuses on communication skills, medical ethics and patient safety systems that underpin clinical practice. Study patient interviewing and informed consent, autonomy and justice in ethics, confidentiality and HIPAA, plus quality improvement, healthcare systems and relevant legal issues. That wraps up the USMLE syllabus overview. Use these domain weights, difficulty levels, and estimated hours to plan a study schedule and focus your practice on scenario-based clinical reasoning. Good luck preparing, and remember, consistent, targeted study is the most effective strategy.